Good afternoon, ladies and gentlemen. Welcome to the Borough Commission of the North Broward Hospital District, January 23rd, 2018. John, you do us roll call, please.
Commissioner Rodriguez?
Here.
Commissioner Uri?
Here.
Commissioner Klein?
Here.
Commissioner Gregoire? Here. Commissioner Wellens?
Here.
Do you have any comments? Wait a minute. The Pledge of Allegiance by Commissioner Yu.
The United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Yu. Comments from the audience?
Yes, sir. I have former Commissioner Cobo.
Commissioner Cobo. Good afternoon, sir.
Good afternoon. I wanted to bring up a couple of points, and I'm sad to stand up here and say it. In the history of this organization, we have never had, or during a sitting governor, more commissioners resign from this board than we have had in the last several years. We have also not had, in the history of this organization, board members, general counsel, and CEO that have been indicted. Even if it's a misdemeanor, which it's sad that that even happened, okay? And yes, you're innocent until proven, you're not guilty until proven innocent. But how can these people sit here on this board and continue the day-to-day operation when last year you suspended, terminated, humiliated, and fired a woman that had been in this community for 31 years, that having served on this board and having been around this place longer than anyone else in this room, because I was 12 years old walking the hallways of Broward General, how could you terminate her in the way you did for an offense that was even before the CIA came into place, in a retaliation way by certain people in this organization? It is very sad. You have a general counsel and an interim CEO going around their corporate offices pounding their chest. Oh, this is a joke. This is a total joke, this indictment. What the hell do you think you are, that you're so far above the law to talk or to even imply that? And by the way, the state attorney's office already knows, okay? Because they've gotten it from a multitude of people. It is also sad that you go pounding your chest about the recent bond. We have some bankers on the board. We're at one of the lowest interest rates in history. And you're so proud of a bond, which, I mean, Murdoch sold bonds, that you got at 4-point-something%? Really? Your medical staff, it is my understanding through many sources, sent you a letter telling you about the condition of what is going on at Broward Health. You're about patient care. I sat where you are. I had to make tough decisions. I had to be involved in selecting a CEO. I had to be involved in selecting a general counsel. And yes, we all make mistakes. I made quite a few. But it is sad that this organization, as I stated before when you made the decision that you made, that employees are scared of retaliation, that employees that have been in this organization, excellent employees, for many, many, many years have been terminated, asked to resign, transferred.
I yield my time to Mr. Cobo.
It is sad that you sit here on this board, and Commissioner Rodriguez, you and I have had our differences, but I'm very proud of what you did today. And you know, you're not the only one. Commissioner Salarulo, when he served on the board, was a lonely vote. I was a lonely vote. There were several of us that sat on this board and took the right position. And today you did, and I respect you for it. I did not say that you had to necessarily choose any of the candidates that you have. Because really good candidates, who would want to work for an organization that has gone through what this organization has? And Commissioner Klein, you mentioned that none of the people sitting in here were responsible for what has gone on. You're absolutely right. It was even before my time. And I fought to have some of the things that happened not happen. And I was sometimes the lonely vote. And sometimes it was a unanimous vote. But this organization has had a history for years of unfortunate political interference and control. You want to do something about changing the organization, and it's nothing personal about Ms. Capazzo, okay? And she's been attacked in the media, justifiably or non-justifiably, I can't tell you, including having a fake degree, or from a degree mill, or from et cetera, et cetera. It's not pleasant to be attacked, I can tell you. But doing the right thing is the right thing. So, you want management? Why don't you consider, this was brought up before, why don't you consider entering into a management agreement with the South Broward Hospital District? They are an organization to be admired. They are an organization that could save this organization millions of dollars by consolidating some of the duplications. And they do have the management expertise. Not 6 months as a CEO, not somebody that has never been a general counsel before, but a director of compliance. People that really have the experience of managing one of the most successful healthcare systems in the country. And at one point, we had that reputation. I was 12 years old walking those hallways at Broward General. My father, internist cardiologist, practiced there.
Good.
I think that's somebody else. So, please, consider what you're doing today. No, you don't have to replace the person today. And yes, there are some things that Beverly Capazzo has done which are to be admired. But we need to look at the long-term solution. We need to do what is right for this organization, because the people that work here day in and day out deserve it. My father has been in the hospital 3 times since the beginning of this year. And it was amazing, and I was appalled by the number of people that approached me and said, oh God, I pray to God something does happen this year to turn this organization. So don't be so proud and pounding your chest of certain things which in the real world, it's a joke. Interest rates are the lowest there are, and you're paying 4.8% for a bond. At least you got it, that I will say.
Thank
Have a
you.
great afternoon.
Anybody else?
Yes, Commissioner. Pastor Allen B. Jackson.
Mr. Jackson, Mr. Jackson.
Good evening. It's great to be back and stand before you guys again today. If we keep meeting like this, I'm gonna have to start taking a collection.
I can assure you I've already passed. You can't get any more blood out of it.
I've been licensed and ordained for over 25 years. I've been pastoring for about 17 years. One of the things about leadership is that you're never going to have everybody that agrees with your decisions in an organization. If you poll certain members of our church, they would tell you that the church is doing well. You could poll other members in our church and they would tell you that it sucks. You can poll other members and they would say, I don't even know why I'm here. The reality of it is that I lead by doing what's right, not what's popular, not what someone pressures me to do, but I lead by doing what's right. And today I want to commend the board for making a decision that's right for the district at this time. None of us have a genie where we can look into the future and see what the future holds. All we can do is make the right decision at the right time, and when the next step comes, you make the right decision, and when the next step comes, you make another right decision, and before you know it, you're continuing to make progress. Again, I just want to commend the board for stepping out and having guts, really, because this was a very tough decision that you made earlier. But I want to commend each and every one of you, and it's not an issue of who won and who lost. It's not an issue of pounding chest. It's not an issue of thinking somebody's bigger. It's an issue of, you know what, you're a 5-member board, and we felt that this was the best decision to make. And so the community is supporting you in this decision. We look forward to working with you as you move forward. We look forward to being a help and not a hinder to whatever the board district wants to do. And so again, we want to thank you. We appreciate your boldness and your courageousness. And it's just been a pleasure to be a part of the process. Thank you so much.
Thank you.
Vincente Broward.
I yield over to the chairman.
Reverend Gary Johnson.
Yes, sir.
Thank you again, Reverend Gary Johnson, President of South Florida SCLC. Again, as my colleague Eric echoed, it is a day that no one is boasting in this day. I think all you commissioners want what's best for the hospital. And the decision you made was a tough decision, and a decision that you will live to know that you made the right decision, because you want a first-class CEO. That's all that matters. And having someone sit in the seat and tell you all to make that decision was the right decision. And until one thing I don't do, I don't get into dirt. I don't operate in dirt. President Obama once said, when they go low, we go high. And I'm gonna stay high. We will never, as this organization, we're a nonviolent organization, but we're a people's organization. And we believe in integrity of people. And today you show integrity. And so with our chairman, who also wants what's best for this hospital, right now, it's time to drive this hospital, this organization, to higher heights. And the only way you do that is everyone's foot is on the pedal, even when you disagree. Because to say you're indicted, others have been indicted too. And guess what? We have mercy on them, because nobody's perfect. And it doesn't feel good to be under that type of scrutiny, because we all have felt somewhat what it feels like to go through those things. It hurts your character, it hurts your family. And so for all of you board members, whether they're reference to you or not, I pray for you, because you are our leaders. And I pray that God move you away from all of this foolishness, that you continue to do the work that you did, even though you're new, Ms. Nancy, Board Member Nancy, and to Mr. Klein and Stevenson and Christopher. You're all working in operation to do what's right for this entire body. And not just the patients, but the employees that sit behind me. Just do right by them, and you will see a very successful hospital, and you can continue to be proud of this day, that you'll look back and remember you made the right decision. So thank you for your time.
Thank you.
Anyone else? All right, thank you. Committee report, pension investment, Commissioner Uri.
Hopefully everybody received the minutes. I think everybody was at the meeting, at least that was on the board, except for perhaps Mr. Klein, but I'll just try to summarize for everyone here. First and foremost, I think you'll be pleased as an employee, as a shareholder / taxpayer, the performance of our pension plan and other invested funds was spectacular last year. The committee in the meeting prior had requested of our consulting firm to do an asset allocation review. We had the results of that asset allocation review and made a few changes to the portfolio. In particular, just to dial back some of the risk on our unrestricted funds. So outside of that, I don't know, Mr. Goldsmith, did I miss anything? Or I think that's the report. Otherwise, the minutes are in your books or online or however else you want to get them. But thank you.
Okay, thank you. So do I have a motion to approve the minutes?
Is that
I'll make a motion to approve the pension investment committee meeting as reported.
Okay, do I hear a second?
second?
Okay, all in favor?
Aye.
All right, request for approval of the minutes of the special board commissioner meeting held November 29th.
You got the quality to we only did pension.
No, we did pension and investment, I have quality, did I skip one? Okay.
Yeah.
Quality Assessment Oversight Committee, Commissioner Klein.
Thank you, Mr. Chairman. We had, there were 3 committee meetings that took place last Wednesday, January 24th. The Quality Assessment Oversight Committee, the Finance Committee, and the Building Committee. I think all 3 were successful meetings. During the Quality Assessment and Oversight Committee meeting, we received a lengthy presentation from a number of the participants within the organization concerning the quality and oversight within the organization. A lot of the numbers are certainly trending in the right direction. Our quality is improving, and it was a very comprehensive report that was presented. I don't believe there's an action item relative to that committee report. So if you'd like, I could continue on to the Finance Committee.
Yeah, go ahead. Do you want to go ahead and review them all and then we'll approve them all?
Certainly. So the Finance Committee meeting took place again last Wednesday. We reviewed the financial statements for the month of December 2017, and we approved or recommended that the board approve an adjustment reallocation of some funding, which is an item on the consent agenda for this afternoon's meeting. Then we had the Building Committee meeting. The Building Committee decided to look into the status of surplus property and to take a comprehensive focus and look at the status of surplus property within the Broward Health system and to possibly entertain options for the disposal or the sale of some of that property. We looked at some bid results. Most notably, we determined that it was necessary to upgrade the communication system to enable first responders to communicate within the hospital system, which is something that's currently impaired. Again, that is something that's on the consent agenda for today, as well as some upgrades to the behavioral unit, health unit for anti-ligature, again on the consent agenda for today. And then we received updates on the status of several projects ongoing within the system, including the Broward Health Coral Springs Bed Tower Expansion Project and Phase 2 of Broward Health Medical Center Children's Hospital. And that concludes my reports, Mr. Chairman.
And by the way, they're all in the book.
No, that's what I'm saying. The minutes aren't, I misspoke.
Okay,
So I think these are informational items, if I'm not correct, no mistaken.
Because the minutes for approval are only the ones 1 through 4. I thought those were 1 through 4 based off of the committee report. I didn't read it.
okay, so we don't have to approve these guys then?
Correct.
Okay, so
The minutes will be presented once they're...
all right,
Chairman, can I
yeah, go ahead.
can I ask you a question? In the interest of community, in the interest of this packed house, I'd like to make a request that we take an item out of discussion agenda. Let's deal with it up front. It's the most important issue this hospital district has faced in the last couple of years. I'd like to take item 12 on the discussion agenda. Let's just deal with it up front while everybody's here, and then we'll move on to the rest of the agenda as scheduled. It would be, I think, would be helpful and appropriate for the importance of that decision.
Okay, what number item?
Item 12, the CEO search final selection.
It's item 12 in the book, but item 14 on the revised agenda.
Okay. Okay, I don't have the revised agenda in front of me, but item 14 on the revised agenda, I'd like to move that right now, and let's deal with that issue right up
Okay,
front.
go ahead.
Do we need a motion to move the agenda item, or is it okay by consent? Okay. Are you making that motion, Mr. Moore?
Yes, I'd like to make a motion.
You have the floor.
I'd like to make a motion to move item 14 on the discussion agenda, the CEO search final selection, to now, and we'll take up that issue and the importance of it.
Do I hear a motion? Second. Okay, second. All in favor?
Aye.
So, you go ahead.
Well, you're the chairman of that
Well,
committee.
you know, I'm gonna vote to hear the motion.
Okay.
I'm not gonna change my vote from before.
Sure. In the prior special board meeting, we took up the issue of the CEO search committee, the final selection of the candidates, and after input from senior leadership, the medical staff, the community, lots of discussion among these members of the board, the decision was recommended that we consider keeping the current interim CEO in place, since the options were not better, and we didn't feel, I don't think we had a consensus that we could get to where we needed to go by making a change now. And I think the recommendation is to keep the current interim CEO in place until the conclusion of the CIA. I think there's a 60-day period after the CIA ends in which we get a final report from the monitor. And I would recommend that we enter into a contract to keep the interim CEO in place until we're released from the CIA agreement from the monitor, at which time we can then establish the future direction of our organization.
So do I hear, that's your motion, right?
Yeah, I can tighten up the motion, but that's...
Okay, that's your motion. Do I hear a second?
Second.
Second. Okay, you want to do roll call, John, please?
You want to have some discussion?
So you want any discussion? No, we voted on this earlier, okay?
I think we voted to recommend it, but I think we have to ratify it this meeting, is that correct?
It's good practice to recommend it because of the notice.
Right. So I think we need to ratify the recommendation of the special board meeting today with an adjustment to the amendment saying that I think that the contract for the interim CEO should be to final release from the monitor, which I think is approximately 60 days after the conclusion. Is that correct?
It could be.
Yeah.
It could be a little longer, I'm not sure.
Well, that's right. I think that we should leave the current interim CEO in place with a contract until the conclusion and release from the monitor of the CIA.
So that's your motion?
Yes.
So I have a second?
Second.
Okay. Do you want to talk?
I think it would be good to hear from Ms. Capasso
Oh,
before.
Of course, I assumed that was going to come up.
Okay,
I should say if Ms. Capazzo so chooses to.
I would like to say something. As I've said all along, I didn't want this for the long term. Actually, my long-term goal is completing my doctorate of nursing so that I can teach the next generation of nursing leaders. Being a bedside nurse is how I started in this field, and helping people just remains the core of who I am. With that being said, I am humbled and honored to accept the term of the contract, and I guess it's another 3 years. My team, as you have seen, we have stabilized Broward Health. We will continue to stabilize Broward Health for our patients, our community, and the 8,000 employees that we have here at Broward Health. So yes, I will accept it if you vote me in. I would be honored. Thank you.
okay. Any other comment?
Well, I think, Mr. Chairman,
That Ms. Capasso is willing to stay with us because we really do believe you
or testing for Broward Health right now?
Mr. Chairman, I think it's just important to note, because a lot of the people who are in attendance here were not at the earlier meeting. There was a board meeting, a special meeting that took place at 1 p.m. today, went on for approximately an hour and 45 minutes, at which time this topic was discussed at length. This is an open process, so the commissioners had an open discussion before the public, because we are not allowed to discuss this amongst ourselves. So we heard for the first time each other's input as to the CEO search and the results of the CEO search. We heard from the physicians committee, we heard from the executive team, and we heard from important community leaders who attended every single interview that we had with the CEO candidates. And there was extensive discussion concerning what's the best course for the Broward Health Hospital System at this point. And ultimately, there was a lot of discussion, and it came down to what's best for the system, whether we're in a position to improve and continue the course that we're on, or whether it makes sense to make a change and the risk that's attendant to that change. And ultimately, we obviously each made the decision ourselves as to what we thought was in the best interest of the system. My own view is that for the stability of the system and for the direction, to continue the direction we're going in, which is an upward and positive direction, to stay the current course with the current executive team. And that makes sense because we reviewed some of the quality improvements, some of the financial improvements, and yes, some of the financing improvements that have been made, which will save the system about $850,000 a year in interest alone. So there were a lot of significant improvements that have been made since Ms. Capasso has served as interim CEO, and she's brought in a lot of quality people. And that shows solid decision-making capability. And those people have performed in their responsibilities very well. So at least personally, that was part of my decision-making process, and particularly with the input of the community leaders and those others who evaluated the CEO candidates. That was part of what concluded, what informed me in my decision-making that this was the right course to continue. Thank you, Mr. Chairman.
Okay, anybody else any comment? All right, let me do my comment.
I apologize, Commissioner. I just wanted to clarify, there was a discussion of a contract at the prior recommendation, and that it's going to be President and CEO is the title, as opposed to interim.
Just as a matter of my recollection, if my memory serves me well, when your contract came about, it's been customary that the Secretary-Treasurer is the point man of the board to work with whoever the candidate or the person is. In this case would be Ms. Capasso, to work out on the contract. You had Commissioner Nealon working with you, because we can all, you don't negotiate a contract.
No, I agree. I was just suggesting that it be made clear from the prior meeting that it is pursuant to a contract was part of the motion at the prior meeting, not to negotiate the contract right now.
Okay,
just
fine.
that there is a contract as President and CEO.
I'm just saying, if there's going to be a contract, I'm just using this as a matter of reference. If there's going to be a contract, the custom has been that the Secretary-Treasurer works with the person. If we go back in time and you're doing your contract, and this was the time, he would be negotiating your contract. But I'm just saying that, you can choose whatever you want to do, but...
is that a policy, or do we need to amend the motion?
This is something that has been traditionally the job of the Secretary-Treasurer to work whoever we give a contract to, Now, I will not be supporting this item, but I do ask that my comments be on the record in full, in the essence of time. I'm not going to repeat them. So here is a copy of everything for you. Okay? Thank you.
Mr. Chairman, can I?
Yeah.
Do we need to amend the motion to include, because I think we did recommend that it would be a contractual obligation, which would specify the time frame to when Ms. Capasso's contract would end at the conclusion of the CIA and release from the monitor. So do we need to amend that?
I would clarify that she's appointed as the President and CEO versus interim, and that as the prior motion was, it was pursuant to a contract.
Okay, so I can amend my own amendment. So the motion should state that that we are going to enter into a contractual obligation with Ms. Capasso as the President CEO of Broward Health for a time not to exceed the conclusion of the CIO and release from the monitor, at which time the board can decide on the future direction of Broward Health. And that contractual obligation would be negotiated according to policies and procedures established at Broward Health.
So we have a motion, we have a second?
Second.
Okay, you, John, would you please do roll call?
Commissioner Rodriguez?
No?
Commissioner Uri?
Yes.
Commissioner Klein?
Yes.
Commissioner Gregoire?
Yes.
Commissioner Wellens?
Yes.
All right, the motion carries.
Congratulations.
Congratulations. All right. Can I go back to on track here?
Absolutely.
All right. Number 2, request approval of the minutes of the Special Board Commissioners meeting held on November 29th. Do I hear a motion?
I make a motion that we accept the minutes of the CEO Search Committee meeting held November 21st, 2017 as written.
Okay, that was a Special Board Commissioners meeting. Second, number 3, request approval of minutes of the regular Board of Commissioners held on November 29, 2017.
Mr. Chairman, if I may suggest that we approve the minutes one by one, because only certain of the members of this board attended certain of those committee meetings and may not each have the knowledge to approve those minutes.
Okay, all right. My confusion here is that we have November 29, regular board meeting, a special board meeting, and were any of these on the same day? What day is this is November, and what was this, one of these committees a CEO search committee?
Yes, the first one was the CEO search committee attended by yourself and Commissioner Wellens.
Okay.
So I think it makes sense to address that one separately so your members who attended would be able to authorize the approval of the minutes.
All right, so Commissioner, yeah, that's right. Commissioner Whalen.
I make a motion we accept the minutes of the CEO Search Committee conducted November 21st, 2017.
Okay, second. So we're the only 2 members on the committee, so, but we,
As a body, we have to.
well, that special council, we had the power to do the search committee, and the 2 of us could make those decisions, correct?
Process.
Okay, so now Commissioner Wellens and I voted, all right? Do the whole board needs to vote again, or just the 2 of us?
On the minutes?
Yeah.
Particular meeting, it's just you 2.
Just the
We're
2.
the only 2 that were in attendance, so we're the only 2 that could vote for that meeting.
Okay, so I second it, so we
Passes unanimously.
we pass unanimously. Okay, all right. Thanks, Commissioner Klein. Request for the approval of the minutes Special Board of Commissioners meeting held on November 29, 2017. Was that a Special Board of Commissioners? Okay, everybody has to vote on it. Do I hear a motion to approve number 2?
I make a motion to approve. Number 2.
Move on second. Any discussion? Having heard none, all in favor?
Aye.
All right, number 3, request approval of the minutes of the regular board meeting, commissioners meeting held on November 29.
So moved.
Moved by Commissioner Uri.
Second.
Okay, any discussion? Having heard none, all in favor?
Aye.
Number 4, request approval of the minutes of the special board of commissioners meeting held on December 11th.
Motion to approve. Minutes of the
Motion to
special
approve.
board meeting December 11th.
Second.
Moved and second. Any discussion? Having heard none, all in favor?
Aye.
Request approval of the minutes of the Special Board of Commissioners meeting held on December 20th.
Those minutes need an adjustment. Board members present, I was present, so I could ask that be amended.
Okay. We can be amended?
Sure, and then you can approve it as amended.
Approve it as amended, all right?
So the amendment would be to remove Commissioner Robeson's name and add Commissioner Gregoire's name.
Correct, all right. It's only a typo. No one said that it was gonna be easy anyway. All right, so we have a motion to approve? And
Second.
a second? All in favor?
Aye.
Medical staff, I want to make sure I got everything, you know, okay? So medical credentials, update, Dr. Taft.
The details of the medical credentials committee recommendations are in your packet under tab 6A through 6D. I'm just going to present a high-level overview. System-wide, there were a total of 24 new physicians and 10 allied health professionals for initial appointments, 115 physicians and 23 allied health professionals for reappointments, for a total of 138. There were 17 voluntary resignations. All the appointments and reappointments were conducted under the terms of the medical staff bylaws and rules and regs. There were no reportable as it relates to credentialing and privileging any activities reportable to the National Physician Data Bank. That concludes my high-level overview, and I'm respectfully requesting the board approval for the appointments and reappointments as stated.
So do I hear a motion to approve?
Move to approve.
Move to approve, second by Commissioner Yuri. Any discussion? Having heard none, all in favor?
Aye.
Okay. Commissioner Capasso, you're on the hot seat now. Interim President CEO update.
Thank you very much. So I'm pleased to report we've had several achievements and events throughout the district as we continue to fulfill our mission of quality patient-centered care while we lessen our dependency on taxpayer subsidy. So the first pillar I'm going to go through, and it's our quality outcomes, our awards and achievements. At our Broward Health Medical Center, the Joint Commission's Gold Seal of Approval was given to our hip and knee replacement program. That is a very rigorous program that we go through, that there's standards, quality, physicians have to be top-notch, the nurses have to be trained specially, so this was quite an honor for us. Also at Broward Health North, same thing, we had a joint commission. What's also, and we're coming up with Heart Month, is very rewarding for all of us, is Broward Health North, Imperial Point, and the Medical Center. We've earned the American Heart Association, American Stroke Association's Heart Check for Advanced Certification for Primary Stroke Centers. And this is also quite an honor. It sounds, you know, you read it and it's like, okay, but I can tell you though that the staff has worked tirelessly to make sure that our patients in the community are well cared for. Again, quite an honor. So as you all, when you visit the hospitals, make sure you mention to them congratulations, because they do a great job. We have our mammography department also won an award. We had a CAP survey, which is a group of pathologists and laboratory techs. They go to each hospital and they grade them, which is, that's your peers, right? Your peers are, and we've done quite well. At North, they said that it was probably one of the best run labs that they have seen in a long time, which is great kudos. We also had at North, as I mentioned, the Joint Commission came for disease specific for total hip and knees, and they gave us accolades. Also, I hope everyone here has had their flu vaccine, because last year, with HR, Peter Nyamore and his team, we worked very hard. Last year, our compliance rate was at a dismal 56%. This year, we're already up to almost 80%. So that's kudos. That's a very good job. Thank you. We also, 2 weeks ago, we're going to go through, and you're going to hear a lot of this, all our hospitals are going to be Joint Commission certified. Again, another rigorous process. We had a surveyor come in to meet with all of us. We showed her around. Lee Gezzi, I don't know if Lee's here for our quality. We put on a PowerPoint presentation. I was so pleased to see the directors got up. They talked about their facilities. She had said that she can't wait to come back because of all that we showed her in the programs we had. So again, that's a kudos to our hospitals because they are doing a great job. Onto my people. Some of you had an opportunity, I saw her coming up here. Again, stabilizing Broward Health, I wanted to fill many of the key leadership programs. And one of the programs, and she's going to speak right after me, was our Vice President of Government Relations, Diana Artiega, as an attorney, and she's joined us. She's responsible for development, implementation, and execution of Broward Health strategic initiatives, which over the next several months I'll be bringing them to you all, regarding public policy and legislative affairs. Diana has already been up to Tallahassee several times, she knows a plethora of people up there. She's a true asset to us, and you'll meet her in just a little bit. I'd also like to welcome, and I don't know if he's here, Paul Schwarzkopf. Paul Schwarzkopf is our new Chief Financial Officer at the Big House, Broward Health Medical Center. He'll be joining us February 5th. He has over 30 years experience in finance and accounting. Most recently, he served as Senior Director of Regional Finance at Tenet Healthcare's Coastal Division, as well as Chief Financial Officer at West Boca Medical Center. More good news, at our medical center, Sandra has hired in, who is a known employee to us, Heather, and I'm going to have her check. She was recently promoted. Is she here today? I wanted her to stand up. No? Okay. As Chief Operating Officer. She has been at Broward Health since 2006. She's had various roles, and now prior to becoming Chief Operating Officer, she is the Assistant Vice President of Strategic and Administrative Services. So we've got some really high quality people still coming in. Our community outreach, this is a great stat. During the month of December, we've held 386 community events, touching over 25,000 lives. Pretty good. Broward Health Imperial Point was a presenting sponsor at the 3rd annual Rainbow 5K in Wilton Manors. The race is a fundraiser for the Pride Center at Equality Park to fund social advocacy and provide services to the LGBTQ community in Broward. We were on hand also with the Man Van. I don't know if you know what the Man Van is. It's it used to, I don't know why we're still calling it Man Van, but it used to just be for men's health. But then we said equality for everyone, so now we can do blood pressure checks. We handed out water. We were the official medical, and I just realized I didn't know they were doing a 5K. I happen to be a runner. If there's any other commissioners that are runners, maybe we can do a 5K. That would be good team building.
Let's call it the health band. Health band.
Health band, right? Because it can't be the Man Band, right?
You got to be inclusive.
Going to get with the times. You're right.
With everybody.
I agree.
So now the van is confused. Do they still park in the same garage?
Yes, yes.
No, we have a special garage made for that van now.
And last but not least, I wanted to talk about some of the growth. Coral Springs, I saw Jarrett was here. We toured the new tower. Gino and I, when we actually put on our hard hats, our glasses, with a vest on, the building is spectacular. I would invite all of you anytime if you want to come take a look. It's something to be proud of. We were very proud, right, Gino, and it's coming along nicely. We also still have construction for Solid Children's Hospital, and then we also have the exterior for North that we're doing. So what I'd like to do now is, as this comes up, I think maybe we should take some maybe posters or something so that I can show you all, if you can't come, the progress we're making and you know, where the funds are going. And that's my report. Thank you.
Thank you. Diana, where are you?
Commissioner, I'm sorry, my report, it's on the agenda in the book.
Well, you don't come.
Well, Thank you so much.
No, where is it?
I know where I stand.
Hold on, I'm sorry,
No,
what?
it's in the book, it's in the book.
Oh,
I have a very brief
I'm
report.
sorry, I apologize, but, you know, somebody,
No worries.
okay, so, anyway, so go ahead.
I'll be very brief.
Give your report.
I just wanted to make the board aware that in the upcoming months, we're going to be having, senior management will be having a strategic planning session with the board pursuant to Florida statutes 395, 3025. And as the time gets closer, we'll provide more details. In addition, I would like to request that the board hold a shade session to provide me with advice and guidance regarding pending litigation to which the district is currently a party under Florida statutes 286-0118. The shade session will be confined to settlement negotiations or strategy sessions related to litigation expenditures in the case of Vazios v. North Broward Hospital District, which is currently in the 17th Judicial Circuit for Broward County. The shade session will be attended by the chairman as well as Commissioners Uri, Gregoire, Klein, and Wellens. Also attending will be Ms. Capasso as President and CEO, Jonathan Abel, who is counsel for the district, and myself. So if I may ask for a motion to allow me to set up a shade session at the convenience of the board.
Okay, General Counsel has for a motion, please, I need somebody to
So moved.
support, okay?
Seconded.
Okay, all in favor?
Aye.
Okay, that's it.
Thank you.
Thank you. Sorry for the,
I told you I'd be quick.
well, you know, I got
No worries.
sidetracked here, you know, so. Anyway, so back to Diana Arteaga.
Hello, good afternoon.
Good
I
afternoon.
didn't realize I was that tall. Okay. My name is Diana Ortega. I'm very happy to join Broward Health. This is my 4th week. I'm very ecstatic to have the opportunity to join your team of professionals. I'd like to commend everyone that I've met over in the administrative offices. They're extremely professional and talented and capable individuals. So you should be very comfortable with the team, the staff that you have supporting you and doing great work for the hospital district. I'll just be brief. I wanted to give you an update very quickly on the flavor of the last 2 weeks, which has been the release of both chambers' proposals on the budget. The Senate proposal includes $50 million to boost hospital rates, but redistributes the dollars without regard for the amount of Medicaid or charity care performed to the detriment of safety net alliances. The House does not include the $50 million, but keeps the funding methodology in place. Although both budgets lead to cuts, the Senate cuts to safety net hospitals are significant, with Jackson Memorial and UF Shands taking the biggest losses, followed by us, Tampa General, and UF Health Jacksonville. Almost no public health system is spared under the Senate formula, from Sacred Heart in the Panhandle to Orlando and Lee. As we move toward conference, we will have our work cut out for us. First, by getting the House to pick up the $50 million, and then encouraging the Senate to move toward the House position on the funding methodology. I know several of you have expressed interest in coming up for the Safety Net Hospital Days the 2nd week of February, so I look forward to working with you and preparing and briefing any of you individually to make sure that you're prepared to come up. So with that, if you don't have any other questions, I will cede the rest of my time. Thank you very much.
Thank you and welcome.
Thank you. Tell Lincoln I say hello. Anyway, here we go. Consent agenda, item 7. Huh? Oh yeah, you're right. You're absolutely right. So do I have a motion to accept the consent agenda? Move and second?
Second.
Okay, all in favor?
Aye.
Aye, all right, motion carries. That was 1, 10, 11, and 12. All right. So 7 to 12. All right, so discussion on acceptance of the interim financial statement for the month of 2017.
Thank you. I'm going to be brief. We've covered a lot of this in the Finance Committee meeting. I'm going to give you a very top-level review, and then I'm going to give you a few key takeaways for December that I think that we should be very proud of.
For the month of December, the district had excess revenue over expenses, which includes gain, loss from operations, property tax, and investment income was a positive $2 million versus budgeted loss of $327K, or $2 million favorable, and $3 billion over budget than fiscal year 2017 December. Year to date, fiscal year revenue over expenses was a positive $26 million versus budgeted loss of $1 million, or $27 million over budget, and $29.4 million more than prior year. So we're doing very well.
It's not more than budget, better than budget.
29 more than prior year. More. Gain and loss from operations for the month of December fiscal year 18, which is really the operational indication. It's really what that measures us on. We had a negative loss of $10,832,000 versus budgeted loss of $12 million, or $1.2 million favorable to budget, and $2.6 million favorable to prior year. Year-to-date fiscal year 18, we have a budgeted loss of $74 million versus a budgeted loss of $73 million. Excuse me, we had an actual loss of $74,983,000 versus a budgeted loss of $73,553,000, or $1.45 million unfavorable to budget. I would like to point something out, however, is that there's a hurricane expense that's in that expense, and we just got word from FEMA that they're going to reimburse 90% of labor and 100% of all damages. So the financial team and the FEMA team are working together to take all those expenses off of our P&L, move them to the balance sheet, and set up a receivables until FEMA pays us the money. So you'll start to see that pick up in prior months. I would also like to point out in that in the budget and miss, there was a $1.5 million Medicaid settlement related to prior years that went through this board and was approved. So if you really do add all that back, we're actually having a great operational year.
Do you know how much the FEMA payment is expected to be?
About between $2 and $3 million.
Do we know a time frame for that?
It's the government. I don't know.
Checks in the mail.
They get our tax dollars really fast.
Yeah. But I do want to, when I look at our numbers and I'm working with our executive team and I'm talking to Gino about, I always like to use fiscal year 17 versus fiscal year 18, because there was some sort of a hurricane in there, which it wasn't we didn't have the damages, but we had the activation costs and we had all the labor, and we didn't get reimbursed for that. So 18 versus 17 is a really good apples to apples comparison, and we've lost on a year-to-date basis $6.23 million less. We've lost less than prior year. Our operating margins, which is a great indication of how efficient a company is managing expenses, for fiscal year 18 has shown a 1.7% increase over prior year. So that's my report of the financial numbers for December. The key takeaways for the month of December: we had excellent expense management in the month of December, $3.1 million under budget. Overtime and agency as a percent of productive hours was 3.2, which is down 2.62% from the time that we started our initiative. What is even more exciting about that is that we've had 6 consecutive trend pay periods of a reduction of overtime, which is an indication that the initiative is working. And also, Peter's job fair that he hired 150 people have not come out of orientation yet to help offset the overtime. So this is really the CEOs, the COOs, the CNOs, and the CFOs at the facilities working every day to make sure that they're managing their labor correctly. So when I did my projections for the year, this initiative right here, even before the hiring, if we continue, which we will, is an annual $4.3 million savings to the bottom line. The other key takeaway that I'm very proud of, this was the first month since I've been here that all 4 hospitals performed at or above budget. So I don't know if Jared's here or Sandra or Alex. That's really them, guys. That's them working every day. They're in the weeds. They're talking to the doctors. They're talking to the community. They're talking to the patients. And that's something that they should be very proud of. And I've had them do forecast projections for the rest of the year, and their projections are coming back very positive for the rest of the year to make us, to definitely hit budget and to exceed. So I think, we are financially stable. I think the operation now is, from a leadership perspective, is stable, and I think that the next 2 or 3 years is going to be a really exciting time for Broward Health, and I'm excited to be here. There's one other thing that I want to talk about, if you give me a few minutes. Jen, are you here? Come on up. So this little lady here, she negotiated, and we just signed the document today, negotiated an $8.2 million savings year over year over year with CVS Pharmacy. What's even more exciting about that is that the employees won't even have to change their drug card. They won't even know the difference. We'll just have to pay $8.2 million less a year for drugs. So thank you, Jen, for that. I would also like to thank Assad. Are you here? Assad was the attorney that worked his butt off, I think, for like the last 3 weeks trying to get this done. Thank you, Jen, for your hard work. And
8.2 is on the base of what?
so it's Jen, what is that, the 8.2 of the base?
17 or 18?
Off the $30 million expense, we reduced it by 8.2.
It's almost 30 bucks. And that'll go every year. That's not a one-time pay. That's a one-time pickup. That's an $8.2 million every year. So we, it's a nice savings, but we have that money earmarked for some employee morale that we'll be bringing to you guys next month.
So let me make a suggestion. Any employee who saves us anything in the millions of dollars, let's bring them before the board and
I hope to see you every meeting.
So that is my report. If you guys don't have any questions, I think it's a great day for Broward Health, and I think we should all be proud of what we're doing here every day.
Absolutely.
All right, Commissioner?
I'll move that this board accept the interim financial statement as provided by and presented by Mr. Goldsmith.
Second the motion?
All in favor?
Aye.
Okay, motion carries. Commissioner comment, Commissioner Grayway. Commissioner comment.
Only, I think we made a very important and very correct strategic move today. I'm so very grateful for the community support, and I'm grateful for the community's comments because it will keep us on the right track. So I thank you all for being there when we need you.
Okay, Commissioner Yuri?
I'll just say ditto. I concur with my colleague here. I'll yield my time to you. How's that?
No, I'm not.
Since everyone's in the yielding mode.
I'll just say that 51 years, served on a lot of boards. This was one of the most difficult decisions I've ever been a part of. Not where I thought we would go, not where I thought we would be when I walked in the door, but I think the input from the community, the importance of the discussion between the commissioners, the great work that this organization has done, I think we're in a good place, and I think for the next 2 or 3 years, we've got stability, we've got focus, and we have continuity. And every organization, whether it's a small company or large company, needs that. And I thank all of you who have gotten us to this point, and I want to thank Deb for giving up another 2.5 years of her life. I don't think she knew we were going there, because I certainly didn't talk to her about it. But I think, but I do think we are headed in the right direction. So we continue, at least I personally, and I'm sure everybody, we continue to ask for your input. Keep the issues in front of us. You know the team, you know the people, and I think you've got an opportunity to get to know them, and I think that's only going to make our commitment and our delivery that much better going forward. So thank everybody that was involved in the discussion and the decision.
Commissioner Klein?
Thank you, Mr. Chairman. I would echo a lot of those same sentiments. As I've said earlier, I think that right now the system is heading in the right direction. I've only been on this board for several months, but I can see the progress that's being made, with the quality team that's in place, with the financial numbers, with the employee hires. We're bringing in quality people, and that is really the key, to executive management. And I think that's been recognized today And as I've said before, we're going to keep moving forward. We're going to keep looking to the future and how we can continue to improve, both in terms of quality and customer service and quality care and our financial numbers, and continue to be responsive to the community. And again, thank you for the community leaders for being involved and being engaged with us, in all of these efforts. So, I think today was a lot of difficult decision making. It was a robust discussion. But at the end of the day, we have that behind us. We now have a firm team in place, a quality team in place, and let's move forward, onward and upward, and God willing, we'll have great success.
Thank you, and congratulations.
Motion to adjourn?
Yeah, so I hear a motion to adjourn? Second?
Second?
All in favor? Then we're adjourned.